This segment of Delmarva Life is brought to you by Delmarva Dental Services.
You know, it's the fall. A lot of kids are playing sports. Are you seeing a lot of sports injuries?
Well, sports injuries, there's 15 million oral injuries a year.
Wow.
And there's 5 million teeth knocked out. And 1 in 10 kids that are playing this year have a 1 in 10 chance of having an oral injury. But throughout their whole life, they have a 45% chance. So you about half a chance, 50% chance of having an injury throughout your whole life.
Is there any one injury that's more common than the rest?
Well, the most common tooth knocked out, guess which one?
Front.
Upper front tooth.
There you go.
Guilty. I've had mine.
Me too.
Well, yeah,
Really?
mine knocked out when I was little, and then another like 2 or 3 times when I was playing hockey. So this one.
Oh my goodness.
Half of it has been bonded and reattached and all that.
Yeah, both of mine are fake.
And that's because it's the most prominent.
Wow.
So what sports are you most commonly seeing these injuries in?
Well, believe it or not, the top 4 sports, the number 1 is, can you guess?
I want to say hockey because that's what I played, but
Baseball.
I said baseball. That was what happened to me. Was
Baseball is 1, 2 is biking, 3 is hockey, and 4 is basketball.
Wow. Now, what kind of ages are you talking about here?
The most common age is 7 to 10
Yeah.
years of age.
And so mouth guards are I guess, probably the most common thing you hear to protect your mouth. Talk to us a little bit about the mouth guards.
Well, there's different types of mouth guards. You have to look at the type of injury. Basically, mouth guards will protect against trauma of your teeth, but they also can protect against concussions. Now, there's some studies that say they do protect, and there's some studies that say they don't. But the bottom line is, if you get hit like this, your mouth guard's not going to protect. If you get hit like this, your mouth guard's not going to protect. If you get hit like this, my son fell backwards last year and hit his back of his head and got a concussion. Well, he had a mouth guard. It didn't do anything. Yeah. But the thing you have to remember is this. When this comes up, it drives the skull up. So a mouth guard stops this from happening, and it also stops damage this way.
Okay. Now, you've got different kinds of mouth guards here.
Yeah, there's different kinds. There's 3 different kinds of mouth guards. There's the kind that you just buy in the store that fit over your teeth.
Right.
They don't really fit that well. And the thing about mouth guards is, if you're going to wear it, you want it to fit. But this mouth guard, if you put it in, you have to actually hold it in place with your lower teeth. So that's the kind that you buy, you just wear.
Right. Okay.
Now there's boil and bite mouth guards. And you heat them up, and then you press them over your teeth.
Right.
Now they fit a little bit better than say your store-bought.
Yeah.
So this would mold against your teeth, and it would stay pretty good. But the best mouth guard is a custom mouth guard that actually fits over your teeth. So, and that's made by dentists with an impression.
Right.
Just like you would make a bleaching tray.
Right.
Or you could make a night guard. Now, a night guard is this. A night guard is hard.
Okay.
See, I had one custom made for my teeth when I was playing, pretty high level ice hockey. I had a custom one made because the ones that you buy at the store, the boil and bites, you chew on them and they eventually break down and they wear down. Yeah. That's what I found anyway. So those custom made ones really just hold in place.
And if it's loose, you can't mouth breathe. And how many people have to mouth breathe when they're playing sports? So now they make some kinds with holes in the middle that mouth breathe, but that you can mouth breathe through.
Right.
But the bottom line is, you want to be able to have something that fits very, very tight.
To do the most good.
Yeah, this is
for the most protection.
Really tight.
And it's not just having one; it's wearing one. You know, you have it. If you have it attached to your cage, you don't want it just dangling there. You actually want to make sure it's in your mouth and you're using it.
To do some good. Dr. Harmon, thank you so much for some wonderful information.
Well,
thank you. I mean, I feel like I'm in the clear now. I was a little nervous coming into this.
Should have seen
I think we're good.
Tell me. No. Now, if you'd like to read more about Delmarva Dental Services or about sports injuries and mouth guards, all you have to do is go to delmarvalife.com.